he got his colon screening because he had an indication.
Correct.
What are some of the other indications? Perhaps we can chat a little bit for the audience about some of the other indications.
Well, some of the other indications that you're looking at is change in bowel habit.
Right.
If you see that you're, going infrequently or more frequently than you usually do,
right.
then you kind of
constipation or diarrhea.
Correct.
Yeah.
Rectal spotting,
right.
if you see
Rectal
some bleed,
right.
and sometimes if you see blood in the stool,
right.
which
right.
is definitely a number one, where you
right.
go see your physician
right.
and have that questioned.
Absolutely. And of course, the family history.
Exactly.
If you have a family history of colon cancer, you should be much more alert to that. Now, what about people who have a long-standing history of Crohn's disease or colitis?
No, definitely.
They're at a
yes.
higher risk.
Yes.
Right, okay.
They should definitely get checked up.
Right.
Normally on a yearly basis,
right.
to make sure that everything
right.
is fine and
right.
they have a good, clean bill of health.
Right. In general, the recommendation is that testing should begin at 50 if there are no indications.
That's correct.
But if you have a strong family history of colon cancer, right, then of course you should get tested the second you have an indication,
exactly.
right? Mm-hmm. Absolutely. What do you tell your patients who, Dr. Mack, who have a strong family history? What age do you tell them to start at?
Well, it really depends. I usually go for a decade sooner.
Right.
But if they are in their 30s and they have a very strong family history,
right.
we, as a precautionary, will go ahead and have them checked. And at this point, we've seen a lot of preventative ways and inhibited a lot of ways of having colon cancer go through.
Well, I will tell you for the record that I've had colon cancer in a patient who was in his 20s.
Exactly.
Right. So colon cancer, again, let me say, is no respecter of age.